Hi, hello, my name is Priscilla Morales, and today we're talking about leukemia. So, what is leukemia? It is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. So, anything to do with the blood, how it's formed, and the cancer of it is leukemia. Causes of leukemia can vary. For example, the genetic factors. Scientists determine that it results from genetic mutation in the DNA of blood cells, mostly the white blood cells. These mutations causes the cells to grow and divide uncontrollably. Some risk factors include tobacco smoke, certain chemicals, ionizing radiation, chemotherapy, viral infections, genetic conditions, family history of leukemia, and inherited immune conditions, and certain environmental exposures. So who is most likely to develop leukemia? It impacts the majority of children, but more than half of the cases occur in people over the age of 65. So for disease prevalence, in high SDI regions such as Australia's and high-income North Americans showed the highest age standardized incidence rate in 2021 at 10.6 and 9.8 per 100,000 populations respectively. East Asia has the most significant decrease in mortality at 46%. That means East Asia has decreased the mortality of leukemia by 46%. There are different types of leukemia. So the first one is acute lymphoblastic leukemia, which starts in the cells that would become eventually red blood cells. Compared to chromatic myeloid leukemia, it starts in the bone marrow cells and moves into the blood. Chronic myelomonocytic leukemia starts in the bone marrow cells that form blood. Chronic lymphocytic leukemia starts growing leukemia in the white blood cells in the bone marrow. And juvenile leukemia is the classification of multiple types of leukemia, which that one mainly occurs in affecting children. So anatomy and physiology of leukemia. Because it's a red blood cells cancer, it affects the production of white blood cell, which is in the bone marrow. It starts in the bone marrow. And it can be spread into other bodies and other parts of the body, like the lymphatic nodes, spleen, or liver. The bone marrow is a production of white and red blood cells that releases the blood cells into the bloodstream where they can mature. However, in leukemia, some white blood cells do not fully mature, so they do not function. These abnormal cell growth then grow rapidly, and then they continue to grow uncontrollably. That's why a lot of the leukemia start in either the white blood cells, what creates the white blood cells, or in the bone marrow itself, because this is the main problem. Some symptoms of leukemia include fatigue, weaknesses, fever, and night sweats, frequent infections, shortness of breath, pale skin, easily bruising or bleeding, red spots on skin. And why do the symptoms occur? It's due to the lack of functioning blood cells that carries oxygen throughout the entire body, fighting infections and stop bleeding. So all of these symptoms, signs and symptoms is due to the factor of the white blood cells not being able to function correctly, and they have a lot of them that do not work properly. The long-term consequences they consider serious complications, including anemia and symptoms of fatigue, shortness of breath, bleeding, difficult fighting infections, or frequent infections. It is all due because your white blood cells are the ones that fight infections are not working properly, or there are too much of them that are growing uncontrollably but not working as well. The mortality rate in the U.S. varies from the type of leukemia you have, and the 5-year survival rate is 67%. However, each of them, depending on what type of leukemia, some are easier to not fix, but high survival rate compared to others. For example, chronic lymphocytic leukemia has a survival rate of 88.5 in comparison to the very bottom with acute monocytic leukemia has a survival rate of 28.1, and that is after treatment. So diagnosis and treatment. Diagnosis is bone marrow aspiration and biopsy, lumbar puncture, flow cytometry, CBC blood tests, and hemisphere smears, immunohistochemistry, cytogenetics, FISH, and PCR. So everything to test the white blood cell count, the red blood cell count, and then the bone marrow production. Your treatments include chemotherapy, which kills the cells faster, targeted therapy, which seeks and attacks only leukemic cells, immunotherapy, which helps the immune system recognize and attack cancer cells within the body. Radiation therapy kills cancer cells in different organs, like they start off at the spleen or liver first, and they start off in different organs, killing them one by one. And then the most successful one was the stem transplant, which helps stimulate protection of normal and healthy blood cells in the bone marrow. That one has a higher success rate due to the fact that you're getting implemented a different person's, a donor's stem cell transplant, so you're getting new, healthier cells that help build healthier and normal red blood cells instead of having your own body create its own. The side effects or risks of the treatments include tiredness, anemia, infection, sore mouth or gut, hair loss / thinning, fertility problems, sore mouth or gut, increase in sickness, nerve pain, nausea, vomiting, skin rash. How can a person be cured? They can't completely be cured. It's not possible for cure, but if you are in remission after 5 years post-treatment, it's considered a cure, which prevents the cancer of relapsing. It's not really cure, you're in remission. And leukemia is not something that could benefit. Not anything that could help diagnose leukemia faster, but there is a machine that can help classify which specific leukemia you have in a faster setting. Instead of undergoing more tests to conclude which leukemia you have, this AI test could determine which leukemia you have. That way it's better and more faster recovery. And those are my remembrances. Thank you.